Hi, everyone. Welcome to our workshop about improving our relationship with food. My name is Katie, and I'm a professional clinical counselor intern, or PCCI.
Hi, everyone. My name is Diana, and I am an APCC, which is an Associate Professional Clinical Counselor. My pronouns are she, her, ella, and I am also the designated counselor for Puente.
Yeah. So today we'll go ahead and go into just talking about improving our relationship with food and specific to athletics. So as we go into our community guidelines, we've discussed these before, but just kind of going over it. Actually, we can go into students first, how this meeting is for students. Y'all are the number one priority, making sure that we are able to deliver information to y'all that'll be useful and helpful. Call in versus call out, inviting people to discuss with us and approaching them from a point of kind of curiosity and wanting to hear more, as opposed to a bit more maybe accusatory and calling them out on things, just wanting to make sure we distinguish that difference. So in this space, we want to call in and not call out. Confidentiality was discussed in this meeting. We would prefer it to stay within this meeting. If you have anything that you wanted to talk about, obviously we wouldn't want to share that with others. So hoping that you don't share any information shared with others as well, just because some things may be sensitive to some people. Also just speaking I statements, talking from your point of view and not speaking for anyone else. And those are the things that we have for our community guidelines. Also wanted to just do a trigger warning that this can be a sensitive topic for some. We'll be talking about food, eating habits, relationship with athletics and food and eating habits, also touching on some eating disorders as well, and just general disordered eating behaviors. So just wanted to give that warning that this may be sensitive to some people. I just want to let you guys know that that's kind of the discussion that we're going towards today.
Yes, thank you so much for that, Katie. And then I also just want to invite you all, as we are going through the presentation, if this is triggering, feel free to message one of us privately and we can support you in that. So a quick overview. So here's just some information that we're going to cover together. We're going to have a check-in, see if you have any, thoughts or anything comes up when you hear the word disordered behavior eating or eating behaviors. And then we're going to define it. We're going to talk a little bit about why this topic and how might this topic come up in athletics. And we'll go briefly into some of the behaviors that you may see in what sports, maybe it's more associated, languages and phrases often used, and what are some ways to improve relationship with food. We did bring in two techniques or two possible ways. One that we want to talk about is mindful eating. And the second one is the STOP technique, which is the CBT mindfulness-based technique. And then we'll talk a little bit about how can these behaviors be improved or replaced? And we do have a little activity to kind of help ground us and just feel a bit more centered after we discuss these topics that can be heavy. And then we have some resources towards the end as well. And then let me click through. We want to go ahead and start off just by asking you all, have you ever heard of disordered eating behaviors? So if you could please pause the video and just write up in the chat some words that come to mind, if you have, if you haven't, or if you feel like unmuting yourself and kind of sharing that with us verbally, let us know. And so we'll give you a moment.
So just going over disordered eating behaviors, it's characterized by emotional and behavioral disturbances regarding eating patterns, body image, and it leads to or can lead to significant distress and functional impairment. This can also, I would say, affect our self-image and self-esteem as well. So it's not necessarily an eating disorder, and nor does it imply full criteria, but we'll kind of get to that in a second. But just to give you an understanding of what disordered eating behaviors are. And the reason why we're trying to bring this up in athletics is because it's very common that a lot of people partake in disordered eating behaviors in athletics. Well, I also will call it DEBs just for short. And it's known that a lot of student athletes suffer from DEBs due to common practices in athletics with the distorted assumption that that's an acceptable way to improve in our sport. So let's say, for an example, if you were a bit heavier, if your coach were to tell you you need to drop weight to be able to be successful, you cutting out eating or you changing your thoughts around eating in order to be successful in your sport is a maladaptive behavior. And it is very common in athletics. So we wanted to kind of bring this up to y'all to bring awareness of DEBs that happen. Because like I said, in athletics is a very common way to try to improve in your sport. So just bringing awareness to that. And just kind of discussing what are healthy and not healthy ways to lose weight for sports. Weight is a big factor that does happen in sports. It's kind of just by nature for specific sports. So we're not saying that if you automatically have thought about gaining or losing weight for your sport, that you automatically have this horrible like eating disorder or anything like that. It's more so we just kind of want to bring awareness that there are healthy ways to adjust your weight for your sport, because it does have to happen for some, and there's also not healthy ways. So kind of just distinguishing the two of those. And then we also want to discuss the difference between DEBs and eating disorders. So the purpose of this group is to provide y'all with relevant information so that you have the knowledge to implement healthy eating habits and recognize the maladaptive ones. So these are kind of just a few key points and why we thought this topic was important for this group specifically. And we'll go ahead and get into details as the presentation goes along. So a question that we have for y'all is, what might disordered eating behaviors look in athletics, or how can it play a role? So we'll go ahead and pause for a second, go ahead and pause the video and maybe discuss or come up with a couple answers to this question.
Thank you everyone who shared and brainstormed. We want to also go ahead and talk about some potential examples of sports that can be correlated to DEBs. Some of the ones that we have here are heavily associated with losing weight or gaining weight. And we have gymnastics, rowing, swimming, wrestling, weightlifting, and cross country. So an often association is that the weight is correlated to success. So if you follow under a certain weight class, that can qualify you maybe to be more successful as an athlete. That's a correlation that's often found within these sports. And again, these are just some examples. There could be many more. We also just want to go ahead and talk about common misunderstood eating disorders, and Katie's going to cover 2 examples.
So like I mentioned before, there is a difference between disordered eating behaviors and actual diagnosed eating disorders. So we wanted to go into that, but just a couple of things before we go into it. This is simply to increase awareness and kind of just to let you guys have some of the knowledge regarding the differences between them. We're not, in going into the slide, we're not advertising self-diagnoses. If you do think that you meet criteria for some of these, please feel free to reach out to mental health professionals like either of us. We're here to help you with that. So bringing this is a lot of heavy information, so it may apply to you or someone you know. So this is simply to bring awareness. So if at any point, like Diana said before, if you want to stop or just take a second because of the things that we're discussing may trigger you, feel free to do so. So getting into this, eating disorders are typically associated with sports because of the reason, or some of the sports that Diana talked about before, weight can be a really big factor in athletics. So going into it, so with anorexia, people know about anorexia. I would say it's really common. So it is an eating disorder, an official eating disorder, characterized by weight loss or lack of appropriate weight gain in growing children. So depending on where you are in life. It's also characterized by difficulties maintaining an appropriate body weight for your height, age, and stature. And in many individuals, it can cause distorted body image. With anorexia, it's also generally restricted to the number of calories and the types of food that is eaten. So those who have anorexia are known for calorie counting, make sure that they don't go above a certain amount. And typically the amount that they cap themselves to isn't like a healthy recommended amount of calories. And also types of food that they eat is something that is characterized with anorexia. You also can't tell if a person is struggling with anorexia by just looking at them. So some people may think, oh, you have to be like super, super skinny to be anorexic. And being anorexic is more so about the behaviors as opposed to how you appear on the outside. So just because someone isn't extremely thin or under eating doesn't necessarily mean that they do or don't suffer from anorexia. It's definitely very personal and something that, like I said before, should be discussed with a mental health professional. And a person doesn't need to be, like I said, emaciated or underweight to be struggling with anorexia. So just to emphasize that point as well. There's also a different factor, which is atypical anorexia. And it includes people who meet criteria for anorexia, but who aren't underweight or don't have significant weight loss. So there are different factors that go into anorexia. So like I said, I'm probably gonna say it again, just make sure you definitely talk to a mental health professional to ensure if you are someone who are struggling with this or maybe know someone, just make sure you talk to someone else about it for sure, who is very educated in this topic. So just emphasizing that. And then also that restriction of energy intake is relevant to requirements leading to a significantly low body weight. So basically, some people may have an intense fear of gaining weight or becoming fat, or just those in general, even though they could be underweight. So that is sometimes the significant low body weight in the context of like age, sex, development that can correlate with that, with the intense fear of gaining weight or becoming fat, even though they may be far from it. It's also disturbance in the way in which one's body weight or shape is experienced. So there's influence of body weight or shape on self-evaluation, or even denial of the seriousness of the current low body weight. So these are some of the factors that go into anorexia. And then for bulimia, so those who are experiencing bulimia may have recurrent episodes of binge eating, which is when you eat an absurd or overwhelming amount of food that's way past the normal standard. And an episode of binge eating is characterized by eating in a discrete period of time an amount of food that is definitely larger than what most people would eat during a similar period of time, and also under similar circumstances. So that, and then also on top of that, there's the lack of control of overeating during this episode. So I know you may think, well, hey, like I eat a lot at one time sometimes, but there are different factors that go into it. So it's the feeling of lack of control when you're eating during this episode. So like I said, that could apply to you too. You may think, I opened up a bag of chips and I ended up eating the whole bag of chips while I was watching TV. So these are behaviors that are seen in a lot of people, but it takes, like I said before, seeking out a mental health professional to be able to diagnose you. So these are common practices that are maladaptive all around, but for bulimia to be diagnosed, it has to kind of reach that extra level. And on top of that, there's reoccurrent inappropriate compensatory behavior, which is binging. So it could come from vomiting, it could come from laxatives, and you kind of emptying yourself that way. So on top of bulimia, there's binging, and there's also the purging aspect where you're trying to get all of the food out. So reoccurring inappropriate compensatory behavior to prevent weight gain. So binging in order to prevent, sorry, purging in order to prevent the weight gain. So it can come from self-induced vomiting, misuse of laxative, diuretics, and other medications, fasting, excessive exercise in order to purge and to get all of the food out that you binged from. And self-evaluation is influenced by body shape and weight for sure. So the binge eating and inappropriate compensatory behaviors both occur. And for bulimia, for the criteria to meet for the diagnosis, it typically occurs at least once a week for 3 months. And binging and purging does not occur excessively during episodes of the behavior. That would be common in those with anorexia. So just kind of showing the difference between the two. And I'll emphasize it one last time. Please make sure that you consult with the mental health professional before diagnosing yourself or others with it. Just kind of trying to bring up the difference between an eating disorder and disorder eating behavior, and how there are very similar behaviors that are amongst the two, but there are differences as well. So just trying to highlight those similarities and differences to kind of give you guys the understanding and the knowledge of disorder eating behaviors versus eating disorders.
Thank you. So we're also going to cover some of the common words or phrases that may be heard regarding, weight and eating in athletics. We have 4 examples. We have bulk up, how many calories are in that, what size are you, and how much have you been eating recently. So there is a more direct narrative that can be found in athletics when it comes to weight. So it's probably most often used and in a very like direct manner. And so these are some of the language that you can hear around that. So we just wanted to provide you with some examples. And then as we continue with the presentation, again, just a reminder, if anything is coming up as we're going through this information, please feel free to pause and take a moment and seek support.
Also wanted to touch on in athletics, it's very common for the athletes to be candidly told to bulk up or to eat more, train more, gain weight. And other athletes are also told that they should cut a few pounds, which typically implies changing or restricting eating habits or adding extra training time to lose weight. So in some student athletes' eyes, this can be a normal and expected behavior in order to succeed at their sport. But in reality, these are dysfunctional behaviors that can lead to maladaptive thoughts, feelings, and emotions surrounding eating and food. So just wanted to kind of touch on what Diana was saying in terms of those are very common things that are said, but they can have a long lasting negative effect. And just because they're commonly said doesn't necessarily mean that they're okay. So with all that being said, just wanting to ask, what are your thoughts on how to improve relationships with food or change the narrative that is kind of given in athletics? So feel free to pause the video and kind of reflect on this question.
Thank you to everyone that shared. So we want to talk about some examples of techniques that can be used or engaged in to address disorder eating behaviors. And we have 2 examples. We have mindful eating and the stop technique. Again, these are just kind of techniques. We do encourage always checking in and just making sure, if you can with a mental health provider to see if these would be the best techniques to apply, as everyone has unique needs. But the first one we want to talk about is mindful eating. Mindful eating is essentially the idea of being in the present moment as you consume food. I think one example that I often hear is try to think about the food that's in the plate and not necessarily I'm having to wash the plate afterwards. And so it's kind of saying, really be there. And the key is to do it without judgment in the moment. And it's about having awareness of what it is that you're having in the moment and the experience that you're having with the food. I do have a really neat example on the next slide, so we can kind of talk about how that looks like. And then another technique that we wanted to discuss was the stop technique, which is a mindfulness, cognitive, behavioral based technique. The focus is on regulating emotions. So often, emotions can be a huge component of disordered eating behaviors. And so maybe thinking of other ways to regulate emotions, to work through emotions. So we wanted to provide the stop technique. And so essentially S stands for stop what you're doing, just take a pause. T stands for take a deep breath. O stands for observe what's happening. So what's kind of happening for you in the moment, emotionally and mentally. As you're observing this, is there anything else that maybe, you could be doing or a different way that you could be engaging in it? And then P is proceed with the new info in mind or don't. So it's really just about giving yourself, I would say, a moment to really think about how you're feeling and to think about, am I going to go in this course of action? Is this the best course of action for myself? Or based on what I'm serving, is there something else that might be better for me? So it gives us an opportunity to acknowledge the emotions as well. And so for the mindful eating exercise that you can try at home, I think it would be really neat if we could try it together, but unfortunately we don't have food with us. But if you can try it at home, you could choose any food you would like to practice with, something as simple. Well, there's many things, but like maybe a raisin or a piece of chocolate or maybe an almond. And what you would do is just run through these steps. So it would be maybe about noticing how the food looks as it's in front of you, the color, how the light reflects on it, maybe the size of it, how it feels when you put it in your hand. And so it's really about kind of the experience. And so you're going to run through all of the different sensations, how it feels, what smell it has. And so I recommend that you run through this exercise with any food and just kind of pay really close attention to the sensations that may be coming up for you and see how this maybe allows you to be a little bit more present with your food. And then let me click through to our discussion.
So just to go over some disordered eating behaviors, maybe some examples that come up to kind of answer the question after that. So some DEBs can be weighing yourself after meals and workouts to see if it affected your number, only eating a particular amount of food in order to not lose or gain weight, skipping meals, trying to get your weight to someone else's, maybe judging others over what they're eating, or maybe yourself. Or maybe even consciously eating significantly less around practice times, games, weigh-ins, whatever the case may be. So these are just some common disordered eating behaviors from athletics that we've discovered. So from that, in those examples, in case you haven't thought of any, maybe what are some alternatives to disordered eating behaviors? So alternative to some thoughts or behaviors that we've kind of talked about throughout the presentation. And then another question is, how can you apply mindful eating or the STOP technique like Diana just went over to be able to help with these disordered eating behaviors? So just thinking about these questions and taking a second to reflect on that.
Thank you so much for everyone that shared and answered the questions. So now we're going to move on to a grounding activity. So hoping through this activity, we can recenter ourselves and kind of prepare ourselves to leave the presentation. We do think it's important to just kind of give ourselves a moment of relaxation and deep breathing, especially after covering a topic that can be triggering for some. So if you feel comfortable, I want to invite you to do it with us. You can turn off your camera, you can leave it on, whatever suits you. Again, it's an invitation. So if you don't feel comfortable, you can just listen along. And so the activity we're hoping to do today is grounding. It's called the 5-4-3-2-1 activity, which is an activity that runs through all of your senses. So we're going to start off with getting yourself in a comfortable position wherever it is that you are, whether that's sitting down or standing up. And the first thing that I want to ask you is, what are 5 things that you can see around you? So look around and maybe there's 5 things you hadn't noticed before. So it could be anything, maybe something that's on your desk, on your wall, on the floor. So 5 things. Once you've identified those 5 things, what are 4 things that you can feel? Some examples might be the pressure of your feet on the floor, maybe the chair that you're sitting on, maybe the temperature on your skin. And then if you feel comfortable, you can pick up an object and notice its texture. So 4 things you can feel. Once you've done that, we can move on to 3 things you can hear. So maybe you can hear something outside your window or in your room. focus on 3 things. Now we're going to move on to 2 things you can smell. Maybe you can smell some flowers in your room, or if you're having some coffee. It also doesn't have to be a nice smell, so it could be maybe something that doesn't smell as good. And then one thing you can taste. So maybe it's that snack that you ate earlier today, anything that kind of pops up. And then once you feel ready and you are done, you can go ahead and return. And then I just want to end this by saying that this is an activity that just helps us stay in the present moment and helps us focus on where we are right now by using our senses. And so if there's any questions or thoughts, do let us know. And we thank you for participating.
So now we just wanted to ask if you had any questions or comments. So we're just going to leave the space to ask any questions. If you maybe were confused or uncertain about anything, or just maybe some comments you may have about the topic. And thanks for sharing if you had any of those. And next, we'll just go into our upcoming workshop. So this has been a 4-part series, and sad to say we have one more, but hopefully we can bring it back in the spring. So on December 2nd, we have the VAR Validate, Appreciate, Refer training. And we hope that you guys are able to come to that and participate in a cool training with Active Minds that we think would be very beneficial to kind of round off this whole Beyond Athletics workshop series.
And before we let you go, here are some resources. So we do want to go ahead and talk about Access and Crisis Line. So if you're needing any form of support from, this workshop or just in general, this is a 24/7 Access and Crisis Line that you can access by calling the number or texting the word courage to 741-741. There's also an email address that you can go ahead and send an email to. It's for our clinic. It's the City MHCC. And then there's also our website and also the Ad City Mental Health, which is our Instagram. And then just to let you know, we do have a Shine app. We offer memberships to students. It includes a lot of mindfulness activities. This is a great resource just to use in general. It has breathing exercises, ways to connect with the community. And then if you are interested, you can send us an email to the City MHCC and we can go ahead and give you your own unique link to join. Thank you so much.
Thank you, and we'll see you next time.